How you doing?
Hey, I'm so good. This is actually my second effort to get on with you.
Oh,
Anyways, hi.
okay. How you doing? It's been a
Welcome
couple of
back
weeks.
from your holiday. How
Yeah,
was
thanks.
Ottawa and Montreal?
Love Montreal. Realize I don't need 3 days in Ottawa. So, yeah,
Well, there's
ramped
nobody
up.
there now, right? We could have set up some meetings for you, but unfortunately, not many folks are in town over the summer.
Yeah, even my son's like, can I get a tour of Parliament? I'm like, my God, somebody's asking for a tour of Parliament.
How
And
nice is that?
I messaged them. They're like, we're not doing any in 21.
Yeah,
Anyways,
probably COVID rules and summertime too.
yeah, but I'm glad to be back. Glad to start interviewing you again.
Well, thank you.
Um,
That's so nice.
Yeah, so it's been a couple of weeks. Okay, let's start. I got a lot of questions. I
All
think I've
right.
hit a lot too. Okay. Half the questions are not COVID related, which is good actually.
Oh,
So,
good.
yeah, but is Mississauga going to change the name of Dundas Street?
So we're asking staff to look at it. I mean, it is a broad reaching change that is affecting not only Dundas Street, but we asked them to bring back a report to see what other streets it could be impacted. And of course, there's huge cost in doing so. So we're going to look closely at it and what the costs would be. And of course, we are facing some huge operational deficits. And there are some who are advocating strongly that we do so because of what Henry Dundas symbolizes as a person and the systemic racism that he stood for, agreeing to delay the abolishment of the slave trade. I think he added the word gradually to the motion.
Okay.
I think the UK was concerned that some other nation may step in too quickly if they abruptly exited the slavery business. So that's very unfortunate. Um, so we're looking at not only that, but also the costs to balance that off. I mean, I really don't think that people knew who Henry Dundas was, other than it was a name of a street, and didn't realize the history previously. So there are some that are advocating that is the right thing to do, and there are others saying, we've lived with it. We didn't know it meant that. It's a huge cost to change it in this time of large operational deficits. It could snowball and lead to other name changes. So there are a group that are advocating we don't. So we're going to wait and see what the staff come back with in the fall. I know my council has mixed feelings on it as well. So we'll wait and see. I'm not going to suggest to you that we will, but I won't suggest to you that we won't. We
Okay.
we
Uh,
do our homework. We're Mississauga. We like to take things
yeah.
slowly. We do we analyze things. We debate them, right?
Okay. And
So
then you brought up an interesting point that you have a committee that's actually looking at other roads that need changing.
was not really a committee, but it went back to write a staff report. So the staff will take a look at other possible. Well, because it's not only street names, there are monuments, there are squares. For instance, Dundas Squares. There's
Yeah.
whatever else could be impacted, including street names. Yes, so we have a
Is
staff are
Judah
looking at it. May or may not be on the list.
Okay. All right. Let's talk about the sinking library. Um, can
Well,
you?
tech, there are so technically the library in Port Credit was built on a former town dump, right?
Yeah.
And so it we have seen some structural changes, and the engineers have gone and done an assessment and have decided at this time they need to study it further. So it is closed, and there is a potential that it could be permanently closed, depending on the cost to prop it back up. So there is structural damage being done. So just to be safe. I think
Yeah.
particularly given what happened in Miami, let's keep everyone safe. It's a shame because we remodeled it in, I think, 2013. It is quite a
I
lovely
remember
library. It is a
the
lovely
Golden
library, but we have to do the right thing, and we have to keep our residents, particularly our children that may be using the library, safe. So let us, do the engineering study and keep
So,
everyone safe.
so the engineering study would determine whether or not the
It's
library can
safe.
actually stay there or it move somewhere else in Port Credit, I'm assuming.
I think so. I don't know where you're suggesting I have a new location for it. We haven't considered that yet. One thing at a time. So, let's take a look if if it can be supported,
Okay.
with deeper beams, and if not, will it be closed permanently? And then what's the next steps? What will we do to support the Port Credit community? There's a
Okay.
nice little library in Lakeview. There's a nice library in Clarkson. So
Okay.
there are others close by, because of course we're renovating the Hazel McCallion Library in the downtown core. So yeah, it is a loss. I was very saddened to learn that, but we have to do the right thing.
Can it be probably maybe built in the new community of sorry, what's that new Port Credit community?
Brightwater or Lakeview. It's very
Yeah.
possible. It's
Yep.
very
Okay.
possible. Yeah.
So actually, can you talk about the new the library renovations and what people can expect at the new library in City Center?
Let me do that next week so I can
Okay.
get more information for you, because right now I could just provide you a broad sort of high level overview on all the renovation that's being done. So let me get more context for you next week so I can
Okay.
tell you more specifically. It's just
Have you ever been?
it's just needed an upgrade and a update.
Yeah, I remember when there was a snack bar behind where the offices were way back when I was a kid. But anyways, have you been to the Vancouver Library, the one that looks like the Coliseum?
I've been to the art gallery. I used to live in Vancouver, so I probably have. I lived there 2 years. Remind me where it is. It is beautiful.
It's is it Robson Street or it's the main?
Burrard or
Yeah,
Robson?
it's
Okay.
fairly new. I think it's over the last
Oh,
10
if
years.
it's, then I haven't. Then I
Yeah,
probably haven't. I lived there some
make
more
this
than
library.
20 years ago.
So,
Hmm.
okay. Let's talk about vaccine passports. Do you intend to push harder in regards to the upper levels of government to kind of get vaccine passports?
Yeah, I don't think we have closure on this issue, because certainly people need a safe and reliable way to provide their immunization status, whether they've been immunized or whether they have a medical exemption. We have seen that there are private businesses, private institutions like Seneca College and some other businesses that are asking for people to be vaccinated, to attend in classroom. Of course, those who aren't vaccinated, I assume, will participate online. So we do need a safe, reliable way to provide that information. So whether it's in, remember the old days, we had those little yellow immunization record cards. And, now we have, if you're going to plan to travel, we can talk about travel as well, the ArriveCan app, and you have to upload your information into that app. So, this is part of a broader discussion. And I think there are a lot of implications, and there are a lot of legalities that have to be understood. Certainly, nobody wants to infringe on anyone's rights. And as the Premier said, set up two classes of people. So we have to tread very lightly. Where would this information be held? What would be done with it, etc. And so, but we were suggesting that because there are businesses, colleges, etc., that are asking for the information, how do we keep that? Where do we keep that information? How do we prove it readily and easily, and provide protect people's privacy as well?
True.
Mm-hmm.
What is have you talked to the Mississauga business community and where do they stand on this?
They're actually consulting with their membership
Okay.
to determine if there's an interest. They weren't aware that the Toronto Region Board of Trade was going to come out so strongly at the time, because they were still in the process of consulting.
Okay.
But you can see that there is a hue and cry in some sectors, right? And so it's something that we have to come to terms with.
True.
Both levels of government, federal and provincial, thought that it would be the responsibility of the other one.
It's always the case. Okay. Um, and what's the latest on the vaccination front in Mississauga?
Yes, I've got those numbers for you. I always prepare those, as you know. So let's just start with the numbers, which are very, very low, and that's all great news. We have 5 cases per 100,000. Like, how incredible is that, right? How incredible. We haven't seen those numbers since last summer, but let's remind everyone that we had a second and third wave, so we don't want that, nor do we want a fourth wave. Our numbers are 3.9, so 4 cases per 100,000 in Mississauga, 8 per 100,000 in Brampton, 1 in Khaled. The R factor is 1 in Peel, 0.6 in Mississauga, 0.5 in Khaled, and Brampton's a little higher. Brampton spiked a little bit, 1.6. I'm not sure why. And then those are the positivity rates. I apologize. So those are okay. Positivity rates are what, 1%. That's fantastic. The reproductive number, that R factor, is all under 1. So that's what you want to see. And then we do see prevalence of Delta variant, and we know that's the one that if you haven't been vaccinated twice, if you don't have your second dose, then that you may get sick with the Delta variant. Now, I'll tell you about the hospital situation too. So the good news is we've administered 2 million vaccines.
Nice. Okay.
That's in Peel, just in Peel. In Peel, we are 78% first dose of all eligible. So that's 12 plus. I'm not just breaking it out by adults, 18 plus. This is 12 plus, 78%. And then we're approaching 60% for second dose. So
Nice.
All very, very, very good. And that's all eligible, 12 plus. If I look at just the youth, the 12 to 17-year-olds, they're 70% first dose, 35% second dose. So they really stepped up quickly to get vaccinated. So that's great. Oops, I have these new AirPods Pro.
Oh, Pro. What do they do?
Pro. Oh, I don't know. They're new and improved, right? I don't know. So William Osler had 7 patients with COVID last week. 5 of them were unvaccinated.
Okay.
And 2 of them, they weren't sure. They may have been non-vaccinated or maybe 1 dose. And their ER volumes are starting to climb. Let's see. Trillium, we have 11 patients with COVID. Again, higher ER visits. We're at 64% of elective surgeries. Cardiac and cancer, of course, are given priorities. We are beginning to close our mass vaccination centers. We know that the International Center is closed, and UTM's Vac Center is closing July 27th, so that's next week. The hospital will only offer the vaccine at Trillium Health, at the Trillium site. And we'll be using more targeted approach when it comes to vaccinations, because gradually we will be closing down the mass vaccination centers, and instead we'll be operating more of the pop-up clinics and the targeted clinics in those areas where they're needed. Let me just get the postal codes. I think it was L4T and L4B. So
the L14, L4B, do you know what neighborhood?
Yes, yeah, I was just going to tell you. No, I beg your pardon. L5A and L5B. So it's Cooksville, it's Bloor-Dixie, it's Malton, and it's downtown Brampton. So the most vulnerable communities. So those are the 5 priority zones. There are 5 of them that have, and they also, when you look at it, have higher rates of newcomers, refugees, harder to reach with respect to not necessarily willing to walk into a mass vaccination clinic. We have to go to them. Higher portion of foreign students as well. So those are the communities we'll be targeting. So not only mobile clinics and community clinics through the pop-ups, also more primary care providers will be providing the vaccine, and pharmacies. So it'll be more targeted approach. Our aspirational goal, we're almost at 80%, right? Our aspirational goal, of course, is 90%. And we're going to keep pushing till we get there. We're going to keep pushing. We recognize there will always be a percentage of people who are unwilling or unable, but we're hoping to hit 90%. So we have very targeted measures for vaccinating our residents coming forward in the future as the mass vaccination clinics close.
And will there be more of a door-to-door approach in these postal codes?
Yes, and even for homebound individuals, more targeted, we'll go to them. Yes, and there'll be people, for instance, there may be in a community where there are high rises if we know of newcomers, so we may go door to door. Whatever we can do to get that last 20% vaccinated will be what we'll be doing going forward.
I will help as much as possible to get
Please
them.
do. Thank you. This will largely be, as Dr. Fauci has said very brilliantly, a pandemic of the unvaccinated.
Well, let's talk about that. I mean, in the fall, they've said that obviously numbers are going to go up in the fall. That's
They
going to
will,
happen.
and
Yeah,
especially with the children back at school, of course it
yeah.
will.
So do you think that there'll be another lockdown, or do you think lockdowns are over?
I personally believe lockdowns are over. I want them to be over. I
Yeah.
think we'll have to manage going forward the best we can, given that 80 to 90% of our population will have received 2 doses of the vaccine. Should you get COVID, which we hope you will not, your symptoms will be less severe, less likely to need to get hospitalized, less likely to be intubated or in the ICU. So it will be kind of a very bad flu you will have for a few days, should you still contract COVID after being vaccinated twice, and a small percentage of people will, but largely it will be a pandemic of the unvaccinated.
And one of the questions I have from a viewer here, what is after step 3? Is it just fully open?
Yes, it is, but we don't have any information or any details about when the larger reopening will happen. I don't believe it'll be in 3 weeks. I think it'll be, I'm speculating. I shouldn't do that, but I would believe the province, if it were me, probably wait till the fall, at
Okay.
least till September. But I'm
Speculate
speculating, and I
away.
shouldn't do that, right? So certainly the province hasn't given us any information. And the one thing I've always asked of them is just communicate, provide
Yeah.
clarity, provide certainty. Those 3 words I've asked for repeatedly: communicate, provide clarity and certainty, so we know, so people can plan, right? So we don't know yet. And I think the reality is they don't know yet, because we've exceeded all our vaccine targets, our health indices, the hospitalization rates, et cetera. We've exceeded all the targets, but yet, with this broader, coming into step 3, we want to watch very closely. I mean, you and I both recognize you have to give it a few weeks to see what happens. Like today, I was out in Eid celebrations, and it was the
So,
first time I've seen hundreds of people gathered. I was at an Eid carnival at Isna. It was wonderful. Eid Mubarak, everyone. But there were 2,000 people there. And I mean, I got to tell you, I was trying to shy away from people. I wore my mask, and I was very reluctant. I'm still a little bit reluctant to go into big crowds, but it was Eid, so I waved at everyone and tried to keep my distance as best I could. So this is the first time we were seeing large numbers gather outdoors, right? First time we can have 25 people indoors in a room at a function. So people are starting to gather and socialize. So we need to give it some time to see what the impact of that will be, right? So I would wait. I think everyone is happy right now that they have the liberty and the freedom they do. This is, we haven't had this much unrestricted activity in 16 months,
yeah.
particularly in Peel and in Toronto. So let's enjoy that. Let's go step by step. Take it slow. Please be cautious, please, and continue to listen to the advice of public health. Wear your mask. I wore mine today, honestly, and I try to avoid people, but that's really tough when there are so many at one place. But boy, the Muslim community was celebrating today. It's Eid, it's the first Eid they had to celebrate. They had the opportunity to come together as a community or as families. So they were very pleased. So there were a lot of celebrating occurring. But be cautious, be
Yeah.
smart. Use common sense, please. You know this. We're in the middle of a pandemic, folks. It's not over. It's
But let me ask
declining, but
you,
it's not over.
how good did it feel to go into a restaurant and order from a menu and
I
partake
know.
in the eating? Like, how good did that feel?
Oh my gosh. Oh my gosh, right?
Yeah, that's
Mind you,
amazing.
I enjoyed the patios, but I to go inside a restaurant, pretty incredible.
Yeah. So,
Hmm.
first one you hit, you gonna tell me? Okay, I won't ask. Is the city still giving away tickets at this point
No,
for?
there have been not for 2 weeks now, not a single
Oh,
offense.
awesome. Okay.
Yep, very
Uh,
pleased about that. You know what we could talk about is the travel
Okay.
loosening of the travel restrictions if you want. So we had a little briefing about that yesterday. And so on August the 9th, fully vaccinated Americans from the US obviously can come into Canada. So that's great news. The airports, without going to the quarantine hotels, but they do need a quarantine plan because of course you have to present a PCR test, a negative test, and I think they're going to test you again when you land and have to wait until you can prove that it's negative before you can go out again. So you won't have to quarantine until you get the negative result. Reopening of some of the airports that were closed to international travel and US travel. Halifax will reopen, Quebec City, Ottawa, Winnipeg, and Edmonton. So very good news for them. And what I didn't realize as I saw that the information about the US travel was international travel will resume September 9th. Again, with only approved vaccines, if you're fully vaccinated, with the vaccines that have been approved in Canada.
Okay.
Because there are some that are not. Some countries develop their own that we haven't approved.
And they don't have a cocktail, right? They can have one of one.
Yes, you can have a cocktail. In Canada, you can have a cocktail. We approve that. That's not a problem. So as long as you have a mixture of AstraZeneca, of Pfizer, of Moderna, or even Johnson & Johnson, we approved it. We didn't use it. I don't think we got the supply, but we did approve it. But there are others from other nations that we have not approved. And so those individuals won't be eligible for the exemption or the travel into Canada. So that's all very good. So no quarantine hotel, PCR test, with a quarantine plan just in case. And the other good news is that, of course, that because none of the vaccines have yet been approved for children, there was that concern that children would have to quarantine for 14 days while their parents didn't have to. So, of course, the federal government has lifted that restriction, right? They don't want you mixing with other children really too closely, like not going back to school or go to camp for 2 weeks. But no, you don't have to stay at home. So just avoid other kids. So that's very good news for some parents that maybe wanted to travel or needed to travel abroad or come back. So that's very good news. Breathe a sigh of release. And now we're waiting to hear the reciprocal announcement, right?
Still sounds like a big hassle, so I'm just going to travel in Canada. So
right? It's the easiest thing to do. I was thinking about international travel, but then I look at those countries that I was looking at and all their case counts are rising. So there's so many beautiful places in Canada, and in fact, maybe even up north or out east or out west, so many places. I am still a little reluctant. I want to be careful. I've gotten through this without being sick, and I don't want to get sick now.
True. A lot of hearts just came in, so. All right. With Mississauga and the rest of the province, obviously everybody being vaccinated and, the second dose coverage has gone up to about 60%, you said. Can we see, did I say that correctly? Is it 60%?
Yep, yes, 50, it's like 57 and rising, so it's very close to, 60. You can almost call it 80 and 60. We're almost at 80 and 60. We are 80 and 60 for 18 plus, but we're almost there for all eligible, which is 12 plus. So it's safe to say 80, 60.
So everybody's wondering, Celebration Square, when are we going to start seeing events?
That's your favorite question.
A lot of people are asking.
Which restaurants am I dining in?
I've been asking that for like the last 7 years.
Forever, yes.
But no, a lot of questions came about.
We don't have plans yet. Sorry, we don't have plans yet.
Yeah.
And we don't have a council meeting. So there will be some. We will be opening it up in September going forward. There may be some of the events in September that will be eligible to move forward, right?
We had probably...
But it's still only sorry?
I was just saying, we had about like 50 messages saying, are they showing the Euro Cup there? Are they showing the Euro Cup there? And I'm like, I don't know. We're not part of... I mean, it's over, right? It's over.
It's over, yeah. No, we didn't show it this year because that would have meant people would gather to watch it and we hadn't...
Oh, it would have been crazy. It would have been...
Remember those years that we did do it?
Remember the rock?
Oh, I remember. It's one of my favorite. So I had to tape some celebratory messages because the square is turning 10 years old, and so it was a memory. Your favorite memories of the square. Whoops.
I think you should return those. I think they're too small.
Are they wrong?
They probably
something. My ears are too big. So Jurassic Park West is clearly one of them, but my favorite, the Bianca Rally.
Oh, that was awesome. Yeah.
And we put that together. We put that together in 3 days.
There's no, you know, her name will never be tarnished, and it'll be fine forever. So
I know.
So
Yeah,
where is the road? Do you know where it is?
We haven't decided that yet,
Okay.
but I'd like it to be somewhere prominent, so we always remember. She withdrew from the Olympics, but a lot of athletes did, especially I think a lot of the tennis stars did.
So,
well, they've got quite a few COVID positive cases in the athlete village. So
71 already. It's gonna be crazy. We already asked this question. Oh yeah, let's talk about the Huron Ontario LRT project. Somebody asked, when is it going to be finished?
Okay, the answer is spring 2024, but probably more likely because there are always some, delays. Why don't we say fall 2024 to be safe? So 2024.
Okay, all right.
Yeah.
Another question we have from a viewer: when will indoor classes begin at community centers?
So we are taking registration for camps, and we are phasing in the reopening of all our public facilities, so our rec centers, our cultural centers, etc., over the next few weeks. Because don't forget, those are all the staff that we laid off, right, back in April of 2020. So we have to recall staff. Some of them have found other jobs because many were part-time or not permanent. And so, we have to hire and train staff and reopen. And with respect to the pools, the indoor pools have to be inspected by health officials. So there is work being done behind the scenes. So we said over the next 2 weeks, we'll be inspecting all the facilities and training and restaffing and reopening.
Cool. Last question we have from a viewer. What has the mayor been up to since step 3, reopening?
It's a great question. So you've seen me more F45. Actually, a few little indoor dinner parties. Small group got a little bit bigger. I'm still nervous about it. I've been at City Hall. I've been doing my press conferences. The press conference will be Thursday morning this week. And then I think we may take a hiatus because we don't have council meetings any longer. So there's not much to report back. So, and the COVID situation is very stable and declining. So that's very good news. So unless there are changes, I think we'll take a little hiatus until the fall, until council is back, unless there's news to report.
Okay. Awesome. And that's it. That's all. Anything else you want to talk about?
My children didn't type in a question today. They don't want to know who my favorite child is.
No, I don't see it. What, did they? Because I didn't get it.
No, I didn't see it. I didn't see it pop up.
And
we remember who that is. It's Athena.
Child. There we go. Who is your favorite child? It just came in.
There we go, right? It's Athena.
Is Athena there?
No, Athena's with Alex, my oldest son.
Okay, yeah. Okay, cool. Okay, anything else you want to chat about?
No, I'm glad you had a great holiday. I'm very delighted that the situation is stabilized, and I want to really thank the residents of Mississauga for following the rules and really driving down the numbers. They really sacrificed a lot so we could get to where we are today. And then the final thought would be Eid Mubarak to everybody celebrating Eid al-Adha today.
Awesome. Thank you very much, Mayor Crombie. I will see you next week. We're not stopping, okay?
All right.
All right.
Well, I may take holidays, so I may have.
Okay.
Maybe not the 2 weeks you took, but I will take something at some point.
Okay. I didn't take 2 weeks. I just didn't take interviews for 2 weeks.
Oh, okay.
I still worked. Yeah.
Oh, I believe you.
Yeah. Anyways. All right.
Thank you.
See you later. Bye.